My name is Margreet Groen. I'm part of the team that prepared this visit and that coordinates the participants and try to connect all the participants with the organizations that are receiving them, and that's my role. The main aspects of the mental health exchange here in the Netherlands are, I think, accessibility to services, to healthcare, prevention and recovery. And there's also a big emphasis on networking, cooperation between all the organizations that participate in this visit. I think these are really main aspects of this visit here in the Netherlands. So maybe the special thing about the visit in the Netherlands is that we of course have a lot of general items in the program, but also a lot of individual programs that are tailor-made for participants' specific wishes and professions and backgrounds. And I think that distinguishes us maybe from the other hubs in Europe. So the organizations that are participating are of course Reinier van Arkel as the center organization in the network in this mental health region. And apart from that, many organizations, many network partners have a role in this visit and are receiving the participants, like community care centers, like other mental health care centers for youth and for elderly. And we're now at Team Groen, and that's the team that provides for very different youth care than normally is the case in the Netherlands. So it's really an enthusiastic team that welcomes the participants today here. Most of the participating organizations, of course, present themselves and their own position in the network here in the Den Bosch region. And they do that by, of course, making presentations, but also guiding the participants around and let them experience also what Dutch mental health clients experience in their treatment. So it's a really various program, and I think it's interesting for all participants. At least that's what we heard from the first group. Just like in many European countries, in Holland we also have some challenges in mental health. And one of the biggest challenges, of course, is doing more with less, due to the ever-shrinking labor market and the people getting older and older and need more care, of course. I think what helps is in the Netherlands, the healthcare and the community care is mainly organized from bottom up and not from top down, because the municipalities have a lot of influence on how the community care and the mental health care is organized in the Netherlands. And that's one of the main things we learn also during this visit, how that is organized. So of course that is a challenge. Another challenge is working together in a network. I mean, we try to do it and we do it, but nevertheless all the organizations have to cope with different visions, maybe on care, on safety issues, and also they have to deal with different financial structures and different laws and acts under which they carry out their services. So that are our challenges. And apart from that, we also see that in every population, also in the Netherlands, that some problems are more and are rising in comparison to earlier days. We see a lot of people, for example, with a mild intellectual disorder, and at the same time we see that the acceptance and inclusion for people with really severe mental illnesses is really hard to do. A few short takeaways from the visit until now is when your story is good, the money will follow. That's one big insight, I think. And the other one is trying to build and create a network around the client. If you do that, for example, in resource groups, then the system and the organizations around it will follow. So start small and then spread from there. That's, I think, a big takeaway also from the visit so far. If I had to give one advice for people that like to come to the Netherlands and take part in the next visit, I would advise them to learn to love to ride the bike, because it will become their favorite way of transport, I think, in the Netherlands. Yeah. Well, if I dream about the best mental health care in Europe, I think the best we could do is really work together and don't let any patient fall in between chairs, because when they do, it's not only bad for the patient themselves, but also for the environment, the family, the community around it. I think if we don't if we are able to prevent patients from letting them fall in between chairs, it would be really helpful for all of us, and for a better and safer and healthier society. So.